Good afternoon, everybody. We'll be with you in a second. We'll just let the room calm down a little bit and let a few people come in, and then we will get started. It's great if you want to leave cameras on. We want to try and make this session as interactive as possible. So if you want to leave cameras on, it's lovely to see you. Although I'm working from a very tiny screen, so I might not be able to see you all very clearly. Right, we will get started. So good afternoon, everybody, and thank you for joining us today for our webinar to discuss the findings of the recently published Care England Sona report titled Workforce Strain, Digital Capability and Resilience in Adult Social Care, and what that evidence tells us and what needs to happen next. So I'm Richard Ayres and I'm a social care advisor at Care England, and I am very pleased to be joined today by Ben Dixon, the co-founder and CTO at Sona, who kindly led the research on the subject we're going to talk you through today. So adult social care services operate under constant sustained pressure, as I'm sure you're all aware, and you experience every day. Workforce shortages, rising costs, increasing acuity and operational complexities, to name but a few. These are no longer kind of temporary challenges. They are the environment we now operate in on a day-to-day basis. They are our business as usual. They are the current normal of how we work today. And today's session is really about three core things. Firstly, what the latest evidence actually tells us about workforce strain, deployment and operational pressures within adult social care. Secondly, why this matters, why it's important, not just for today's delivery, but for sustainability and resilience of services over the next few years and the periods to come. And finally, what providers and system leaders can realistically do to strengthen resilience, improve their visibility, and to support their workforce, even with a more constrained funding environment. We have to note we've got the Employment Rights Act coming into play, and the Fair Pay Agreement that brings unions into play. So it's really important that we do protect and look after our workforce, because if we're not, they're going to lean to the unions to get that kind of protection and support. So we want this to be a very practical conversational session. It's definitely not a sales webinar in any way, shape or form. So we really want to just have a good old conversation and a chat about these issues and see if we can kind of talk through some of the solutions. So Ben's going to bring the kind of the technical and data perspective as Sona's CTO, and I'll try and ground the discussions in sort of what Care England's members kind of tell us on a day-to-day basis. We're very happy to take questions, as I said, during the session, but we'll also have some time at the end where we can sort of put hands up or pop questions into the chat. And the link to the full report will be dropped into the chat shortly by Abby. So without further ado, Ben, would you like to introduce yourself and to those who've joined the call today, and it'll just give us a bird's eye view of the report that we're going to delve into today?
Yeah, I'm super excited to be here, I think. So thanks for the introduction. As Richard said, I'm Ben. I'm one of the founders of Sona, and I've been working in sort of tech for frontline workforces for the last 10 years or so now. And the journey that led to Sona was, prior to this business, and myself and my co-founders had a business where we had about 10,000 people working for us, sort of 10,000 frontline workers working for us. And so we experienced firsthand the difference between saying there were 10,000 people working here and the complexity that sits underneath it, and what it means to have the right people doing the right things at the right time, and how difficult it is when that goes wrong. So this report was one that was particularly interesting because some of the challenges that we'll talk about today were very much things that resonated from sort of my own time managing a very large workforce, and that was what led to us sort of building Sona, because we wanted to build technology that allows us to do it better. So this is a national survey of over 300 social care professionals. It ranges across the front line into the C-suite, delving into sort of deep sector interviews with people, and it's wonderful working with Care England in it. And without sort of jumping ahead or sort of spoiling the rest of the conversation, I think what really jumped out was just how different the picture can be when you look at it from a bird's eye view and you say, oh, are there the right number of people working in this building at this time, versus the reality on the ground, where being correctly staffed over the course of a week can mask the fact that at any given time there can be huge pressures where the total number of people in the building might be correct, but the people doing the exact work that was needed aren't, and just how difficult it is going and getting that extra level of detail on what's really happening moment by moment, and what does that mean for the people working there.
And the report's great, and it's clearly very key to your heart and your experiences, and your desire to really enhance kind of care provision. And the report really does address things at all levels, which is, you know, what you've just said. But those pressures really do come through in the report, and it's great that we can kind of shine a light on them. So Ben, let's start kind of with the current picture that kind of every provider should sort of really understand. The report shows short staffing is no longer episodic. It's a kind of a baseline operating condition for many services, and you know, around half of providers report being short-staffed, you know, some of the time. And importantly, this isn't just about kind of vacancies. We talk quite a lot about vacancies, and the Skills for Care data kind of gives us that number every year of what those vacancies are. But, you know, services can appear fully staffed on paper, but are still very operationally fragile because, you know, things like rotas don't match acuity, demand and complexity. What can you tell us in the report around those areas, Ben?
So yeah, I think it was like, I mean, it's worth sitting with that number for a second as well, which is like, I think it was 49% of businesses are short-staffed at least some of the time. That a little bit over half are relying on, like, regularly relying on overtime to cover those gaps that aren't covered by rusted hours. And also, but almost most alarmingly, that over half are genuinely concerned about burnout in their staff. So having done all of this work to recruit incredible people, that these sort of these gaps are leading to potentially losing those people to burnout. And so I think that what we've tried to surface a bit in the report is the extent to which, particularly these sort of the micro gaps, or the gaps where things like the type of staffing isn't fitted to the acuity, or where perhaps the commissioned hours and the rostered hours don't necessarily line up, just how much sort of strain that's creating below the surface, and the way that services, the individuals there are doing an incredible job. They are managing to provide an incredible level of care given the pressure that they're under. But if you've got 50% of businesses relying on overtime to provide that, you've got a huge amount of fragility that's starting to exist in the system, because, you know, if 50% of people, 50% of businesses rely on overtime, and 50% of businesses are worried about burnout, you're treading a very fine line before there just aren't enough people to plug those gaps. And I think sort of providing visibility into that and helping people to understand what are the biggest levers that can be pulled in a given unit or in a given business to fix that is something we've spent a lot of time thinking about.
You touched on agency there as well, and you know, agency is currently at its lowest level since pre-pandemic. But I think and a lot of providers sighed a big sigh of relief there, because they're like, oh, we've got agency under control. But actually, agency at its pre-pandemic levels was a major issue. But we've agreed what the new normal is, and I think that's the danger we see ourselves getting into, is that we keep resetting the baseline of what normal is, and it keeps raising constantly. And I remember having the conversation pre-pandemic about how much of a problem agency spend was, but because it peaked, very much like the energy crisis, our energy costs peaked, and when they drop a little bit, we think, we've solved the problem, and it's still a huge issue for us. And I think with international recruitment, that plug being pulled, we are going to see agencies spike, because that's going to have an impact on vacancies across the sector. We know we had a shortfall in the last 12 months of 30,000 domestic workers. And if you look at the market oversight data from the CQC, you can see there's a slight uptick in agency costs. I think Carterwood's also show a slight uptick. So we've got to our lowest point, but we're starting to see that increase. And there's still providers out there saying we don't have any agency. That's great, you haven't got agency, but actually, what is the strain on your current workforce? What are you doing? Is it goodwill? Is it bank? Is it overtime? What is it that's keeping your organisation up? Because dependency continues to rise. That's not going any lower. Year on year, we get people with high levels of dependency coming into our services, and residential units today are what nursing units were, 5-10 years ago. Neighbourhood health is on the NHS 10-year plan. That's going to have a huge impact on us as care providers. We're going to have to look at more preventative measures within the community, and that means we're all going to have to take on more work. Now, that's going to be a challenge for our staff. I mean, a lot of them want to embrace those challenges, but again, goodwill, exhaustion, it can kind of run out. Delegated healthcare is another set of tasks that are coming our way. So I think there's some of the points I'd say from Care England's perspective that kind of really shows the pressure that we've got. And we need to kind of like put evidence behind kind of what members have been telling us over the years, because the system itself is designed with a very small level of slack. And then kind of once pressure increases in one or two areas, there's only so far that kind of the staff can really go.
And I think oh, sorry, I was going to say, I think sort of when you see the pressures that were people talked about in the report, you see that sort of 53% staff wellbeing and burnout, 36% difficulty retaining staff. And it's sort of, if you did a thought experiment and said, well, if we took away agency, which is the thing that was providing some slack in the system before, what would you expect to happen when you took away that slack? And you'd think, well, people won't do the right thing, so they'll try harder. And you're starting to see in the data now those things building up, that people are worried about burnout. They are starting to struggle to retain staff. And so you start to see that back pressure building up somewhere else. But like you say, because the agency numbers look good, people are taking quite a lot of comfort in that, I think. And it's easy to hide what is potentially quite a serious problem behind, because the slack's being moved elsewhere.
Yeah, and when you put that on top of tight margins, due to increased operating costs, national minimum wage, real living wage, the national insurance contributions on employers, as well as being on employees, general inflation, fee uplifts that don't cover inflation. We've got to try and decarbonise and plan for the future around sustainability. And we've got regulation and a regulator that's in a bit of a pickle at the moment. On top of all of this mandatory training, it just continues to add more and more pressure on the system. Now, I know Abby's dropped a question there, so it'd be really great to hear from providers if they really feel that does reflect their experience, being staffed on paper but stretched in reality. It'd be really good to hear what some providers have to say about that. I think why it matters, one of the most uncomfortable findings is that in the research is that the workforce commitment remains high. And most staff say that they intend to stay with their employer on the surface, and that does look really positive. But what the data really tells us is that loyalty is masking fragility in the sector, because people are staying because they care about the residents, they care about their colleagues, they care about doing the right thing, not because the operating model is necessarily sustainable. So we've created a bit of an artificial view of what our staff feel and believe. What are your thoughts on that, Ben?
Yeah, I mean, I think that's something where we spend a lot of time thinking about what can we do to surface those signals earlier. Because I think that sort of if you get to the point where you're relying on retention as a metric to find problems, it's a very risky place to be, because retention is such a laggy metric, particularly in a sector like care, where there is so much goodwill, where people do want to do the right thing and feel a lot of loyalty. And so sort of by the time that the problem starts showing up in the retention figures, at that point, it's almost getting a little bit late to do very much about it, because at that point, you've probably lost quite a lot of really good people. So we spend a lot of time thinking about what does it look like to surface data that is more of a leading indicator that can start to show you these are the types of things that, if not dealt with, are likely to lead to a retention problem in 6 or 9 or 12 months. So particularly where you have how granular and how real time can you make your view of where is care delivered and care budgeted for diverging, or where do you have pockets of overtime developing where overtime at some level can be a good thing. Some people are actively looking for overtime, but if you start to see a sort of a trend across a single unit diverging very, very quickly, that's something that should be surfaced to management very early to say, is this overtime that is wanted? Is this sort of strategically deployed overtime, or is it overtime that's being deployed to mask something else? And if you can get that data sort of earlier on and act on it early, then you can do something about it before it becomes a retention issue.
Yeah. And I think overtime is an interesting one, because when we traditionally think about overtime, we think about paying extra rates and premiums. Very often we're talking about bank staff or extra shifts at the same rate, not necessarily always paying overtime rates, but sometimes that is the case. And providers potentially probably need to take a bit of a step back and ask themselves if they feel they're fit for the future from a kind of like a goodwill perspective. Because what we've seen is that a lot of providers have got data that tells one story, but the reality on the ground is slightly different. And goodwill is one of our sector's greatest strengths, but it can't be the mechanism through which risk is managed. If resilience, depends on people constantly stretching themselves, then that's not resilience. That's just deferred failure for a time, down the line. So understanding how short sort of staffing ladders are at certain times is really helpful for organisations. Rota designs. I went to a conference, it's nearly 2 years ago, and this was when agency was really high. And it was at the One Advanced session, and we were talking around rotas and rota management. And one gentleman said he had 28 different shift patterns and had no agency as a result of it. And the gasps around the room of people thinking, how could you manage 28 shift patterns? But that's how he was able to kind of manage his solution. I don't know how he did it because I never actually got his name. I wanted to ask him afterwards. But rota design, that it masks invisible strain and does really impact on quality, which is very often picked up by the regulator. In terms of the report, Ben, it's very clear that it's not about individual providers failing or failures by providers. It's the operating model many providers are working within, does not reflect the reality of rising acuity, the fluctuation of demand, all those things we talked about earlier. Commission hours don't always reflect the reality. We're certainly not funded in that regard by commissioners because they're stretched themselves. So providers are constantly just absorbing the gaps. What are your thoughts on those points, Ben?
I think that I think what's but on both sides of the equation, everyone is trying to do the right thing. Everyone's trying to deliver sort of high quality outcomes. And I think what sort of jumped out to me was that there's often this quite unequal negotiating position when working with commissioners in terms of being able to show a clear line between the acuity levels, the staffing provided, the commissioned hours available, and the outcomes that are achieved. And so there is often this gap between the ability between people to say what they know is true, which is that probably the hours that are being sort of allowed for aren't sufficient, and being able to build a clear case that can be given to commissioners in a way that allows the commissioners to say, yes, we agree, this does make sense. And again, the more data that can be captured at the high levels of granularity to say, when we do these things differently, then we can achieve better outcomes, the more likely it is that a bridge can be made between the people sort of commissioning the care and the actual reality on the ground.
Yeah, and I think the lack of visibility is a key point that we really do need to understand as providers, to really understand what's happening at a ground level with the workforce. And we've talked quite a lot about the problem. And I think I'm hoping that providers are identifying with those problems and those situations, because they're things that members tell us on a day-to-day basis. But we need to kind of start thinking about what the solutions are. And I know from Caring's perspective, the sector is, the way in which the sector is designed is wide and diverse. Providers have always done their best within, funding and commissioning constraints. We know that local authority and NHS budgets are incredibly tight. We know that the vast majority of local authority commissions don't cover the cost of care, and we then have to look for self-funders to try and cross-subsidise where we can. There are parts of the sector that can't subsidise, but we accepting the fact that residents are significantly under the cost of care, and that we tend to take that position as a care provider. If I've got an empty bed, it's better to take someone in at a lower cost, because a full bed is better than an empty bed, because at least it's some revenue. But that really does start to thin out our margins, and it's the race to the bottom. And whilst we as care providers legally cannot collude and agree that we price fix and we say, no, we're only going to take people in at what it costs to provide care, which is what we probably need to do to solve a lot of these problems. We physically can't do that because it's unlawful to do it. But if we did do it, we would start to see increased revenues coming into care providers and create some of that capacity to invest in the workforce, more staffing and technology. It really does come down to kind of the strength of the buyer and their abuse of their monopoly power against us care providers. So we do blame funding, but we continue to join frameworks as care providers because it's part of our business model that we accept people below what they cost. Ben, have you got any sort of thoughts on sort of practical approaches and evidence of that? Did any of that shine through in the report of how providers have looked at funding pressures?
I mean, I think the in terms of like sort of practically how to make the situation better, the main theme we've seen is that where it's very easy to see a problem and want to throw technology at it, because that's sort of a default in lots of places. But the thing that actually matters is, or the thing that seems to have the biggest impact, is where the systems that you're using operationally to do things are also the same systems that you're using to understand what happened afterwards. You're much more likely to have believable evidence that can be used to say, well, this is what's been happening in the past, and therefore this is what needs to be different in the future. And what's happening too often is the technology that's being used isn't necessarily always fit for purpose. And so the technology is just somewhere that things are keyed into afterwards. And I think that's gotten much better with care planning, but in sort of staffing, it's not always quite there. And so what you want is for an operational system to capture, what did I expect to happen? What did I need to happen? What did I expect to happen? And then what really happened? Not what is the view that people on the ground would like to have reflected. So it's very important that, you know, sometimes people won't always want to, if things didn't go as planned, they won't always want to capture that. And you want them to be able to capture it in a way that is in no way negative to them, but means that you have that raw data that says, well, look, actually, these people were on the ground for this long, and that wasn't the plan originally, or these people were meant to be working like this, and that was not originally what their preference was. Because if you don't have that historically, it's very hard to pull out those trends and say, okay, the reality on the ground is this, and this is why I know that to be true. And that disconnect between what happens operationally and what just gets filled in afterwards can add up very, very substantially, particularly over sort of larger care groups.
Yeah, and I mean, like from a technology, we do have that sort of retrospective aspect to it. I know that there's lots of systems where we're providing data to evidence something which doesn't always necessarily create change. It's not necessarily always proactive. And you know, you've talked around you know, the workforce pressures and rota fragility and what have you. But in terms of the report itself around digital maturity, what did the report tell us around kind of care providers' digital maturity? Oh, have I lost Ben? I think I've lost Ben.
Just bear with us. I'm on getting him back, Richard.
Oh, brilliant. Wonderful. Just bear with us for a few moments. I do apologise. So I don't know whether anyone, I haven't had a look at the chat quickly. We've talked quite a lot about the problems. It would be really great for providers to chip in to really help us understand whether they identify with the issues that we're seeing, because we want to start, when Ben comes back, we want to start talking around the solutions really, and what the report tells us. Please do download the report if you haven't done so already. It does give you some really great indications of maybe some things that you don't necessarily know your workforce are considering, or your workforce are experiencing, that might be masked by some of the systems that we operate. How are we doing, Abby?
Yeah, his internet just completely went off. So he is reconnecting. He will hopefully be on in the next minute or so, Richard.
Well, we do always say when you're working with someone who comes from a technology company, it's always their technology that happens to fail when you're doing a webinar. We had it on cybersecurity recently, and exactly the same thing happened. So I think Michaela's popped a question there.
Sorry about that, everybody.
No worries at all. Well, we were just getting onto the technical bit there, and then the technical stuff dropped out. Ben, I was just prompting you really to kind of talk through kind of what the report said around digital maturity and visibility of, you know, how we make those pressures visible, and rota fragility and what have you.
Yeah, I think sort of follows on quite nicely from the last point, that the important point there is that we should think of digital very much as core infrastructure rather than something that gets layered on afterwards. So it should be a foundation that everything else sort of grows from, and that you see that as digital maturity in an organization improves, and as you measure digital maturity, you naturally get that much better visibility of what is the pressure on the workforce, where do we have fragility in rosters, what can we do differently in terms of how we hire and staff to manage that fragility. And you start to get those leading indicators that we talked about earlier of where do we have certain cost patterns or deployment patterns that that indicate that there are risks. I thought your example, I'm really interested in the person you mentioned who had all these different deployment patterns, because again, something that we see is that you start to be able to, there are some deployment patterns that are very, very clever, and they can be used to mask things that are, or in a very positive way, they can be used to deliver or get to good outcomes despite having enough staff. But if you can detect when those clever patterns start to be used, the types of patterns that people are using to deal with the fact that actually they just don't have enough hours to deploy it, you can use that to flag internally and to make cases externally that something needs to change and something needs to be different. And you see that in the data that as organizations go on these sort of digital transformation journeys, they start to have this visibility and they start to be able to make those sort of changes.
Well, Michaela's put a great question in the chat, actually, Ben. Michaela said, what key questions should organisations be asking when they're looking at implementing a rota system or a care management system or switching between systems, and do rota systems integrate with care management systems?
Yeah, it's a great shout. I think like the question that's always at the top of my list for any technology, not just rota management systems, isn't actually about the technology. It is what's wrong with the business at the moment that you'd like to fix with this. So what is currently the thing that's painful or that needs to be better? Because I think quite often technology gets not rolled out for the sake of it, but it gets rolled out as a sort of end in itself, and it should be a means to some sort of other ends. And so I think that if the challenge you're trying to address is this sort of visibility, it's worth spending the time mapping out what are the areas where we don't have enough visibility. For example, is it about the gap between commissioned hours versus delivered hours, or is it about visibility into differences between paid and versus worked hours, or whatever that set of problems is, and having a really, really clear set of criteria that aren't about the technology, they're about the kind of business change or the business transformation that you're aiming for, and pushing vendors to assess themselves against how they will help you meet those criteria. Because I think vendors, ourselves included, like we love to talk about our products and our clever features and all the things that we can do. And that's not really the point. The point is that how would we apply those to whatever it is you want to be different about the business? And I think on the integration side, yes, absolutely. Good workforce systems should integrate with care planning. We're looking a lot at the moment about how deep that integration can go. I think sort of it's been exciting getting to the point where there is some level of integration, that people being supported and the shifts being delivered can be linked more clearly, and that can lead to sort of better reconciliation of care delivered versus care commissioned. But the next level of that information is quite interesting, where if you start to get down to activity level, if you start to be able to understand throughout a day exactly what will people be doing, how much more accurately can you identify where those pinch points are, where yes, maybe over an 8-hour period you have enough people there to sort of meet the requirements, but if there are certain activities planned at certain times, perhaps you actually have something where for half an hour or 45 minutes you're going to be understaffed by about 50% because everything's happening at the same time. And can you then feed that back into care planning and start to say, well, if we redistributed these activities, or if we redistributed who was responsible for who at these times, we could get to something that was more balanced. And so I think like the integration's gotten much better in the last 24 months, which has been great to see. But I do think we're only scratching the surface of what can be done there. Because in theory, what computers ought to be good at is that thing of like, here are a huge number of constraints, here are the people we have, and here are the things we need to do, down to sort of the minute or the 15 minutes. What staggering of these would start to make sense? And I do think that we've only got sort of 5 or 10% of the overall industry into what's possible there.
And I think that integration point is a really interesting sort of subject to kind of delve into, because there are organisations out there who have a whole suite of products that say that they can provide an end-to-end solution for a care service, and they may do a fantastic job. But I'm very much of the mindset that there is no organisation that does everything the best. Sometimes you need to look at individual organisations to do things that, to stay in their lane, to do things really well. But it means you're plugging and playing and switching technology continually between partners, and that can be really challenging. And I think there's a role for AI integrators that actually just are platforms that sit agnostic of technology, where you can take out your PCS and plug your Nourish in, or take out your rostering and plug something else in. And actually the system still does the bit at the top, because technology shouldn't be just about implementing technology for technology's sake. It needs to kind of impress on leaders where the pressures are in the system and what you can do and what you can change. And your example there, I think, was really clear, is that we have rotas, and we develop rotas to make sure we've got staffing that we believe are going to be able to meet the need throughout the day. But it's those peaks and troughs throughout the day, those things that happen that we can't necessarily always have visibility of or control, that can really pull the rug from underneath us. So we want technology that actually helps us to understand, actually, we could move our day around, we could do certain things differently. And we've seen that in a few services that have done it. And it's a complete transformation around moving to a very different way of working. I'm just looking at, I think Melanie's dropped another question in there. Michaela's dropped another question there. What level of AI should I expect in these programs? And should I even be asking this of a rota or care management software? Interesting. So in terms of rotas, I think there probably is a part to play for AI, and I think there's also a part to play in care management systems, but it's what role it plays. I mean, Ben, you're much closer to technology than I am. What are your thoughts on that?
Yeah, I mean, I think that the underlying point with all of this is, and to your point about the integrators, Richard, I think the underlying point is it's very, very important that everybody owns their own data, because it's really interesting phrasing, right? What level of AI should I expect? Because everyone's talking about AI at the moment, but the actual level of adoption across not just care, but sort of most frontline industry is still very, very low. We're still very, very early days for that kind of technology, and no one quite knows what directions it's going to evolve in, if they're honest. Everyone has theories, but no one quite knows. But the thing that everyone does know is that in order to make use of it, you will need to own all of your data. So on that topic of sort of what should be looking for in a system, whether it's workforce or anything else, one of the most important things at the moment is that the system isn't putting up any walls about access to data for yourselves or other systems. And we've seen it less so in social care. We've seen it happening quite a bit in hospitality, and it's now people pushing back on it a lot, where vendors are trying to put things in that say, oh, you actually can't use your own data from our system for AI unless you're paying us for the AI. And that sort of lock-in is going to be really, really dangerous. I think in sort of things like in rostering, it's all the boring bits. It's all the things that a human being could do, but it would take them hours and hours and hours of dragging it around and saying, oh, well, does this look better? Does this look better? We worked out there's about, for an average week in an average care home, there's about 10 million valid rosters that you could submit, and that's just valid rosters. That's just rosters that approximately meet the staffing requirements for that location. And there's no way a human being can possibly look at those things. So all of those tasks that are time consuming, and we know that we don't do them as well as we could because human beings can't, AI will be able to do, and AI will be able to reduce to something that you don't need to think about over the course of the next year or so. But the insurance that you need to have to take advantage of that is to make sure that you own the data as you're sort of digitizing systems, that there is a clear plan for how do I own all of my own data, so that whichever system turns out to be the best at that, you can feed that into that system over the next sort of year or two and take advantage of that automation.
Yeah, and I think that there's I learned a phrase on a different subject recently around acoustic monitoring, and someone introduced the phrase human intelligence, and AI is no good without human intelligence, so there's always a role for human intelligence. But I've recognized myself, and I was very anti-AI 12 months ago, and it's completely transformed my way of working and thinking, because it means that I can ask questions and I can get lots of different answers back, but I still have to determine what that answer is specifically for myself. I can see another question's gone in the chat. I can see a hand gone up as well. So I'll come to the question in the chat. So yeah, this is a really interesting one from Nicola. Moving from paper-led processes and disconnected systems to an integrated approach, it's not just a tech shift, it's a culture shift. And I think that's really, really important. So, how we plan and respond and support managers in real time. Again, I've got a family member who's a manager, and she says to me very often, I didn't sign up to be a manager in the current environment because it's very different to 10, 12 years ago. So for organisations that have already gone through this kind of transition, what factors had the greatest impact in getting teams to fully embrace it in day-to-day practice? That's a great question. I don't know, Ben, have you got some thoughts on that?
I mean, I think the single best thing we say when we're trying to help organizations, or the best thing we see when trying to help with adoption of things like this, is when the people involved with the process doesn't stop at C-level or C-level -1. I think all of the best sort of change projects we've been involved with, the initial rooms had representation all the way through the organization, and at each stage of it, there were people involved from every level, so you didn't end up with this sort of fait accompli at the end of it, where the people who are actually going to be responsible for sort of working with the new systems or the new processes or whatever it might be end up being handed something and told, well, this is how things are going to be. The ones that have worked are the ones where the sort of the people on the ground were involved with the process throughout. And we quite often find that when it comes to sort of system design and process design, an awful lot of the most valuable information in terms of how the process should change, not just how well they'll be received, comes from the people on the ground. It doesn't come from sort of the more senior layers sort of dictating down. So I think that sort of cross-organizational involvement for us has been the single biggest predictor of success and of adoption.
And I think that is the perfect time to introduce Claire Leake, who I just seen put her hand up there as well, because you've been through this very transition yourself as well, haven't you, Claire? And we couldn't have even predicted that you would put your hand up then, but thank you very much for doing it. I don't know, did you have a question, or I mean, I'd love to hear your comments on that last point as well as your question, if that's okay.
Yeah, of course. I mean, yeah, I did have a question actually. So it was just sort of expanding on Nicola's point in terms of the cultural piece. But for us, when we talk about, you know, the pressures that we face in terms of the workforce, a lot, the second regularly cited reason for colleague absence, unplanned absence, is family leave pressures and, you know, sort of emergency leave and, you know, children going off sick or family care and responsibilities. And there's an awful lot of, you know, sort of requirement for flexible working, and just sort of building on the AI piece. I think the biggest struggle that our managers have, and this is a huge cultural issue, is the rotas have been in place and they've always worked this way. And my expectation is largely that colleagues need to be available 24/7, 7 days a week, you know, and if you've got a family, then just work around it. So I think when we look to technology and AI, what we need to be able to do is make that conundrum really easy for our managers so that they can put all the various variables in that then churns out, well, here's what you could do, because to your point, you could end up with thousands of different types of permutations. But really what we want to do is enable our managers to just start entertaining those conversations, and then all of a sudden we're probably looking at reduced levels of absence because we're working around that flexibility piece. We're always going to have absence, you know, and that's the reality. But I think where we need technology to help us is understanding some of those critical repeatable issues that managers and, you know, colleagues face week in, week out, and then yourselves as the experts behind the platforms listening to us as the end users and the customers and saying, right, how can we help solve some of these problems for you? Because that will help us shift and change the conversation internally and through the culture piece, because we're providing a way to take that anxiety and that sheer amount of, I've got a staff team of 170 colleagues, how am I possibly going to accommodate everybody's wishes, you know? So I think that's where we need to partner with our technology, you know, sort of partners in terms of solving some of these points. So that was my sort of point to you, Ben. How far are we maybe from seeing some of that happen for us?
In terms of it being able to present the sort of subsets of decisions and this sort of thing.
Yeah.
So some of the sort of, and again, it is quite new, but some of the more advanced setups that we've tried recently are doing things like saying, for this set of care requirements, for this set of staff, with this set of contracts, with this set of preferences, here's what a perfect roster could look like, for example. And it won't send it out automatically. It's not telling them that they have to do that, but it will show them what is the optimal thing that you could do if you wanted to. And then we're finding that some people will go and do that directly, and some people will change it back to something that was more similar to what they've done in the past. So we are starting to see the first sort of practical examples of that really working of those. But again, trying to design it so that it's a suggestion rather than a computer telling them what they have to do.
Yeah, and it's the added thing of not ever forgetting the fact that our rosters are built around the needs of the people we're supporting ultimately. And there's got to be that understanding that this is, yes, we'll try and be as flexible as possible, but and then you've got your, sort of data that we can inform ourselves on in terms of predicting where we're going to see people taking that unplanned absence because we're coming up to half term or summer holidays and things like that, where, arrangements fall through. Okay, thank you. Sorry, Rich. Sorry.
No, carry on, Claire.
Taking off. No. I just sort of slightly forgot what your earlier point was, Richard, that you wanted me to comment on. Was it about integrations or?
Well, I think you've sufficiently covered it. It was really on the subject of the rotors, but no, thank you very much, Claire. I really appreciate it. If anyone else would like to pop their hand up and ask Ben a question or to talk about a situation or discuss it, it would be really good to hear from you. I think in terms of some practical things to take away from the report itself, there are sort of three key points for 3 key points for leaders. It's really around tracking that invisible strain on service. Of the services themselves, on the staff, not just in terms of vacancies, overtime and agency reliance. Those are the things that we're all measuring, but missed breaks, uncovered shifts, and those are the leading indicators of risk. And Claire's already talked about the bit that you can't predict, which is when those families are going to call upon their loved ones to support them, and they will prioritise that over work for absolutely the right reasons. But again, you can look at patterns of behaviour that sometimes give you data, and that's where maybe artificial intelligence along with human intelligence can help. Secondly, we can probably test our rotors, reflect that make sure they reflect the real acuity and the demand that we see in homes, and they're not just commissioned hours. And I think home care and care homes, very, very different beast in terms of hours of commissioning, but there is definitely an opportunity to look at diverse, more flexible rotors that give you that capacity to flex. And I think the Employment Rights Act is going to challenge us in that way slightly because of guaranteed hours coming. None of us really know how we're going to impact that. And I think that's probably a good question to come back to you on in a moment, Ben, if that's okay. And then the last one is, we can maybe just use our workforce and deployment data to really strengthen those conversations with commissioners because they need to fund that care. But let's just come back to that point in sort of terms of guaranteed hours going forward, Ben. We're going to need technology, aren't we, to help us understand what those accrued hours, those accrued liabilities are. So before I bring Nicola in, do you want to just comment on that for us for a sec?
But I think it's sort of as if the equation of rotors are basically a really complicated equation of what are the care needs, what are the people that are available, and what are the people's preferences, and then trying to solve that. And we're now adding another, that was hard enough already, and we're now adding another axis, which is how do we then manage the guaranteed hours and this sort of thing. And I think it's just going to be one more factor, and we saw this with things like predictive scheduling in the US sort of a few years back in places like California, that it just goes from something that is hard to something that is almost impossible to do completely manually. And so, yeah, I think it's sort of more of the same, but it will move us into a world where it will go from being much easier to do it with technology to almost impossible to do it without technology, I think.
Thank you. Nicola, would you like to ask your question?
Yeah, sorry, I'm actually full of cold and I've got a chest infection, so hence why I wasn't on camera, otherwise I would have joined you. But yeah, I think mine was just more so around about, and Ben will know this, knowing about Voyage. So we're just about to go live with Sona as well. So we've been working extremely hard with them over the last 12 months. And I think it's just really great hearing real life experiences from anybody who's also gone through this. And I know it's sort of like links to what my previous statement was. But I think from Claire, I don't know if it sounds like you have gone through it, you're going through it, or you've been through it. I don't know, is that correct in saying that you've moved over to some kind of digital rota management or?
Yeah, we're upgrading on our existing platform. We're just implementing Sona for the HR element only. So we're working on integrations at the moment. So
brilliant. Yeah. So I think it was more so around, sorry, Ben and Richard, it was probably more so about Claire and anybody else actually from a peer-to-peer kind of point of view. It's what kind of what did you actually prioritise when you went through adopting the rota management and sort of any tips or tricks. I know Ben's going to be like, we've got loads ourselves, but it's always nice to hear it from other people that have gone through it from the opposite side of the table. So it was just more so about just sharing any positivities that you found, or and the opposites, any struggles that you encountered as a company.
Right. So we chose to upgrade our existing platform because we'd already invested a huge amount of time and expense to implement the first iteration. So staying with made sense to us. And importantly, it had the link through to payroll systems and also to our billing. So it was driving those set of other outputs for us. And with the HR side, we were starting with spreadsheets, so we had no incumbent system. So it was great, as in, we had a blank sheet, a blank canvas to work from. So I think in terms of things that have worked well have been getting the training and the phasing of implementation as sort of clearly defined as possible, and not trying to take out, to be too ambitious with that implementation plan. I think also the time spent up front in terms of scoping everything that you want to achieve from your digital platform is really important. And I think I've already got probably a huge list that's got National Care Group's name associated with it, with the Sona development team, in terms of, on your product roadmap, can you please add this, this, and this? Because there's, from a customer or a provider's perspective, we want systems to be really working for us. We want to see them as an enabler for our organization and to enable us to grow and respond to all of these other headwinds that we're facing, the Employment Rights Act, etc., through automation and through using systems rather than just bursting into flames and throwing people at the situation. So I think that's what we spent a lot of time, which was really, how do we get the most out of this big investment that we're making in technology, and how do we make that feel from the end user perspective, whether it's team leaders, managers, senior leadership, that they're getting a tool that's really going to aid them, give them data and analytics, make life easier for them, give them prompts, and also automate all those workflows, moving away from emails with everybody, so the manager makes a change, it pings out automatic emails and instructions to other, sort of stakeholders in the process. When we were sort of struggling and challenged with things like changes and leavers processes, and then tracking assets for the IT team and things like that. So all of a sudden your systems really do become that integral infrastructure of the organization, and replace picking up the phones, because you've got it more smoother. So I would happily have a call offline, but it's the time, the energy, and having really strong project management on both sides as well.
I think we're really excited, and Ben will know this because we're coming from a world where we don't have an HR system, which is unbelievable for a company of our size. But so trackers and spreadsheets are literally our bread and butter. So that would be nice to move out of there, but also just to have, we work on 2 systems at the moment, so Cold Harbour and Max Time, very ancient, very outdated, especially for what we needed, and they don't talk to each other either. So you're working off several different platforms. So I think we're all just, I joined this just in the hope that I would learn more and be reassured, and it's always nice hearing it from other organisations as well. So it was just nice to hear that, Claire, so thank you. It's definitely going to be, we're excited about having a digital platform and all the bonuses and benefits that come from it. So it was nice to be reassured from that point of view. It's a big change for us.
Thank you very much, Nicola, and thank you, Claire. That's been really helpful, just to have 2 people on the line, one implementing Sona and one who's actually implemented parts of it as well, because that was very unplanned. But I think what I take away from what you said there, Claire, and it rhymes with what sort of Ben's mentioned as well, is around the systemization of everything, making the processes far more efficient, far more effective, cutting that complexity, reducing emails. My gosh, that would be amazing. And then just trying to kind of unpick and raise to the ground the sector we have that's built on spreadsheets, which 10, 15 years ago I thought was such innovation, and I loved it, but we overdid the spreadsheets, I think, in adult social care, and we really shouldn't have. We should have been looking at technology far sooner than just relying on spreadsheets. I think the key point that the key points in the report, and please do download and read it for yourself. None of those points that are addressed really require a system to be reformed at a government level. If we wait for Casey to report, by that time we're probably going to have a reformed government, and we have no idea what that's going to look like. So we can look at external forces like government, local government, central government, the NHS to fix us, to solve our problems. It's not going to come anytime soon, and when it does come and the solutions are on the table from Casey, we're probably going to be looking at a reformed government, and that could really pull the rug from under our feet. So you know, the steps that we've kind of talked through can be explored. Please look at the report and consider sort of what you can do yourselves, because it really does mean that you as care providers need to make these changes, because they're not going to happen for you. Before I kind of move us to sort of the last few questions, if anyone has any, and a close, Ben, is there anything else you kind of wanted to kind of talk about?
No, I think that was a perfect close, actually.
Actually, well, look, thank you, Ben, thank you, Claire and Nicola as well, and for everybody for attending. It's very much appreciated. The research doesn't tell us that adult social care is broken. It just tells us that the sector is resilient, but too much of that resilience is being carried by people. And we are a sector built on people. Our most valuable resource is our staff, and they keep us afloat. And we just need to be cognizant and aware of the pressure that's put on them. If there's one message to leave you with today, it's this: that resilience is not about coping better. It's about designing services that can operate safely and sustainably in the reality that we are facing on a day-to-day basis. So what we've got coming down the line is the Employment Rights Act and the Fair Pay Agreement. They are going to challenge us as employers. We need to make sure that we are looking after our staff. We're understanding the pressure they're under. We're meeting their needs, because if we don't, the unions will come in and make us do these things. They are looking to get into our sector, and we've got to be very, very careful to make sure that we are supporting our staff. Unions are also a positive thing. I'm not going to say they're a bad thing, but there are things you can do yourselves as an employer. But if you don't do them, the unions are probably going to force you to do them their way. The Sona report is kind of there to be used to reflect on your kind of processes, you know, use within your management and your leadership teams, use it with your boards, use it in conversation with commissioners. I think it's a useful tool to talk about commissioners, because they really need to understand the strain and pressure you are masking as care providers. And if it helps move one conversation from a we're coping model to we're a sustainable model, then it's really doing its job. So a huge thank you to Ben, a huge thank you for those that contributed. And I think we're going to drop a couple of other questions in the chat. Have we done those, Abby?
Yeah, I'm dropping them in now, Richard.
Fabulous. A couple of questions there for you to kind of contemplate. Please do read those questions. It'd be great to have your thoughts on them. It will help us to kind of design and develop other sessions that might be helpful to you to know exactly what you want. We'll make sure that we send a copy of the recording out to anybody, and we'll send a link out via email so you can access the report as well. Just a huge thank you to everybody, and I will give you a couple of minutes of your time back. But please do just give us some notes on those questions if you can. Thank you very much.
Thank you all.
Thanks, everyone.